Next, I would like to invite Dr. Piyush Mishra, an associate professor in Department of Pharmacology from GMC Jalon. Sir has pursued his MD Pharmacology from Motilal Nehru Medical College and has done his senior residentship from MAMC and completed his DNB in 2018. Sir's areas of interest have been clinical pharmacology, pharmacogenomics, and pharmacovigilance. Sir has published many research papers on various reputed journals. Now, Sir will be presenting us on the topic serious adverse event reporting in the clinical trials. Over to you, sir.
I'm Dr. Piyush Mishra and I'm an associate professor in the Department of Pharmacology, as I've been introduced. So I would be speaking on topic serious adverse event reporting. So before I begin the topic, I just want to, I know you all would be familiar with the terms adverse event, adverse drug reactions, and what is a serious adverse event or reaction. I just want to uh, recollect that adverse event is any untoward medical occurrence or in a patient or a clinical investigation subject who is administered a pharmaceutical product or a drug, and this does not need to be there need not to be a causal relationship between the event and the treatment. But on the other hand, the adverse drug reaction, uh, uh, I can differentiate the adverse drug reaction into two parts. One, adverse drug reaction which are occurring in clinical investigational patients, and others which are occurring in patients which are in routine clinical practice. So in patients who are in clinical trials, any noxious and unintended response to a pharmaceutical agent at any dose. So because it's the patient is in a clinical trial, so dose may not have been the adequate dose may not have been determined. So any noxious and unintended response which occurs at any dose in a patient who is participating in a clinical trial is considered an adverse drug reaction. So here, a temporal relationship between the event and the participant and the drug or the equipment has been made. On the other hand, adverse drug reaction in patients who are taking drugs or equipment which have already been approved by the authorities. In those response, adverse drug reaction is a response to a drug which is noxious and unintended, and which occurs at doses which are normally used for the prophylactic, diagnostic, or therapeutic use. So there is a difference between. So in adverse drug reaction in clinical trial, the doses are not yet established. So at any dose, an adverse drug reaction, adverse event which has a temporal relationship with the drug is established, and any reaction which occurs is known as adverse drug reaction. But in after the drug has been approved and into the market, any response which is noxious and unintended and which occurs at doses normally used, that is an adverse drug reaction. So what is a serious adverse event? So serious adverse event is any say untoward medical occurrence which results in either death or is life threatening, which results in inpatient hospitalization or prolongation of hospitalization even for 1 day. So suppose the patient was already hospitalized and adverse drug reaction occurred, and the prolongation of existing hospitalization occurs even for 1 day, then it will be regarded as a serious adverse event, or any serious adverse event which resulted in persistent or significant disability or incapacitation. That would also be classified as an adverse drug reactions, and which results in congenital anomaly and birth defect. Suppose the patient was pregnant, and after taking the medication, there was a congenital anomaly or birth defect in the newborn. Then it will be considered a serious adverse event. Beside these, we have to take into account that our medical and scientific judgment also for determining serious adverse events. Suppose there was some event uh, which required intervention, and medical intervention or surgical intervention which did not cause immediate life threatening or results in death or hospitalization. But if it was unattended, then it would have caused serious resulted in serious events like death, life-threatening event, or inpatient hospitalizations. Those events have also be taken into account and classified as serious adverse event. As we are, as this conference is based on clinical trials, and we are talking about clinical trials, so I would be limiting my short topic on only reporting of serious adverse event in a clinical trial settings. So, so first, how my topic will be moved. First, we will have a world perspective, especially the US and the European perspective, and what is the timeline of reporting, and then I will move on to the Indian perspective and how we are using it in clinical trials in India, and especially what's important for me is the reporting of serious adverse events in academic settings. So for clinical trial reporting by FDA in the US, in the North America continent, and in the European continent by the EMA. Uh, so all the serious adverse events should be notified to the regulatory authorities within 7 days of the occurrence of the event, and the sponsor getting to know that the serious adverse event has occurred, and within 7 days the regulatory authorities have to be notified, and in the next 8 days, so within 18 days, a report, aggregated report, should be presented to the regulatory authorities detailing the events and the details of the patient, and these I will be covering in the subsequent slides. And all other serious but unexpected areas which are not fatal or life threatening should be reported within 15 days. So within 15 days, they should be reported on, an aggregate report should be presented within 15 days of the sponsor coming to know about the serious adverse drug reactions. And aggregated report has all the individual case safety reports, and uh, and all the serious and the non-serious unexpected areas. So this is the flow sheet of the what FDA and EMA uses for the expedited safety reporting requirement for individual case safety ICSRs flow in clinical trials. So this is the so suppose a clinical trial is going on, and a event is reported, and an adverse event is reported. So we have to so the clinical investigator has to determine whether it is a serious event or not. If so, by serious event, I've told you it should be life-threatening, or it could have resulted in death, life-threatening, hospitalization, prolongation of hospitalization, and inability in persistent of significant disability or incapacitation, or may have resulted in a congenital anomaly or birth defect. If any of these events did not occur, then the adverse event or the adverse reaction is maintained in a clinical study database. However, if it is a serious adverse event and a causality and positive causality has been done, so the causality assessment has been done. So then then it is a serious suspected adverse reaction. If its causality assessment proves that it is adverse event, the serious adverse event is not due to the drug, so that is again maintained in safety database. So whether it is whether the serious adverse reaction was expected or not, if it was expected, then it is maintained in a safety database. And if it was not expected and unexpected, then whether it has been it is fatal or life threatening. If it's fatal or life threatening, then you have to have an expedited report within 7 days. And if it's not life threatening, then a 15-day expedited report is presented to the regulatory authorities. However, this has to be done by the sponsor. However, the investigator must report to the sponsor any serious adverse event within 24 hours, whether it is considered, whether or not considered to the drug related or not. So any serious adverse event should be reported by the investigator to the sponsor within 24 hours, whether it is whether the causality has been done or not. My computer is hanging up. Just wait. Okay, so this is the Council of International Organization of Medical Sciences form, and it's a standardized reporting form to maintain data quality and completeness. So as you see, it has different, as in our ADR version 1.4 form, which we use to report the ADRs, it has the subtopics are similar. So a complete safe serious adverse event report form includes subject identifiers, which you can see at the top. Then the study details: what was the product name, what was the study design, whether double blind, single blind, or open label study. What was the narrative of the event, whether there was any temporal information on the onset of action, whether what was the stop date, what was the start date of the investigational product, what was the medical history of the patient. This is very important to have a complete medical history of the patient, because sometimes the event can be associated with the comorbidities of the patient. Suppose a patient was of asthma, and there was a dyspnea after taking the medication. So if we know that the patient has a history of asthma and is prone to asthma, so the dyspnea episode may be contributed to the medication, and also to the comorbidities which the patient may have. So this is very important. And any lab information or tests which were done after the reporting of the ADRs, and any interventional procedures and histopathology information which may be available. And another important point is that the concomitant medications which were given along with the test drug or the suspected drug, and biopsy results if applicable in cases of, and causality assessment if it has been done. So for causality assessment, we need a temporal relationship between the time at which the drug has been taken and the time at which event has occurred, and a D challenge and a re challenge. So coming to now we have some idea of the world perspective, when to report and how to report the serious adverse event. Now coming to the Indian perspective, and what as a clinical investigator or sponsor we have to do if we come across a serious adverse event in a clinical trial in an Indian setting. So I've divided this in the timelines: who will report and who will report to whom, and what will be the actions and comments taken by the regulatory authority. So within 24 hours of SAI occurrence, the principal investigator will report about the serious adverse event to the sponsor, the Drug Control General of India, and the Ethics Committee, and he will present the initial report. So within 24 hours, the principal investigator will report to the sponsor, to the regulatory authority, and to the Ethics Committee, and present an initial report, which will briefly outline the whatever happened, initial event which has happened to the subject, and what actions, or whether any action was taken or not. And within 14 days of occurrence of severe adverse event, the principal investigator and the sponsor will give a detailed report to the ethics committee and DCGI and the head of institutions. So within 24 hours, the principal investigator will report to the sponsor or the DCGI and the ethics committee. Within 14 days, the PI and the sponsor will report to the ethics committee, the head of institution, and the Drug Controller General of India, and give an detailed reports or analyzed reports. And within 30 days of the receipt of severe adverse event report by the ethics committee, the ethics committee has to report it to the DCGI on the recommendations of the analysis, and if any compensation have to be given or not. So keep in mind this this flow diagram is very important, that within 24 hours the principal investigator will report to the sponsor, and DCGI and ethics committee will give an initial report. Now after within 14 days of the occurrence of the serious adverse event, the PI and the sponsor will give reports to ethics committee, DCGI, and head of institute, and will present an analyzed report or a complete report. And within 30 days of receiving of this analyzed report, the ethics committee will report to the DCGI and give its recommendations on the serious adverse event, and will also mention about the compensation if any is needed. And within 60 days of receipt of severe adverse report by the DCI, DCGI, expert committee will sit on the serious adverse event and will report to the DCGI on the recommendations and the analysis recommendations of serious adverse event, and whether any compensation has to be given or not. And after 90 days of the severe adverse event receipt of the severe adverse event report, the DCGI will report back to the sponsor and will give its orders what the sponsor has to do regarding the serious adverse event. So within 30 days of the receipt of the DCGI order, the sponsor have to report order the PI to pay the compensation to the patient, and what intervention intervention would obviously already have been done. So within 30 days of the receipt of the order, the sponsors have via principal investigator has to give compensation to the patient. So this is the detailed flow sheet of how a report of serious adverse event has to be reported, and what actions have to be taken, and the timelines for the reporting and the actions which have to be taken. And you can easily go to the CDSCO site. One who was involved have to go to the CDSCO site and have to register under clinical trials, And after registration of the clinical trial, after registration of the principal investigator, and we can start reporting the serious adverse events. So serious adverse event, this is an online Sugam portal which is available on the CDSCO website, and this is same as what Sion's form was. It's very similar because obviously we have to. There are some changes over here that uh, obviously you have to have the start date of the serious adverse drug reaction, the stop date of the adverse drug reaction, when was the adverse reaction made aware to the investigator and the sponsor, what was the uh, any brief description of the severe adverse event, whether any de-challenge or re-challenge was done, what was the date of the de-challenge and re-challenge, and whether the reaction subsided after discontinuation or dose reduction, uh, whether this is a de-challenge, and the re-challenge if the same reaction occurs after the treatment was restarted or the drug was restarted. So this is a very rare phenomenon that the re-challenge would be done, and date of re-challenge. What was the outcome of the result, whether it led to hospitalization, death, severe incapacity or disability. So this is a user manual. All can go to the CDSU site and look at the Sugam portal. It's a very nice and detailed site for clinical trials. So, these are the how report. What are the points which have to be reported in in a clinical trial or bioavailability or bioequivalent studies. So obviously there would be patient details, and there would be only initials, or uh, there won't be any identifiers to the patients. There would be only initials of the patient. Then there would be gender, age or date of birth, weight, height, and then what was the suspected drug. So, what was the generic name of the drug? For what indication was it given? For at what dosage and strength? What was the daily dose, and what was the regimen? Whether it was being given once a day, twice a day, thrice a day, weekly, whatever would be the. And in case of cancer drugs, if they are given in different cycles on different days of the cycles, what is the route of administration of the drug? What is the start date and the at what time, whether it is being given in the morning, in the evening, or twice a day or thrice a day, what was the stop date of the treatment of the drug, and what was the duration of the treatment. Then coming to the next point, what were the concomitant medication which were being given, and especially in the Indian setting, this is very important because not only we follow the allopathic branch of medicine, we also follow different branch of medicines, and patient may be taking drugs for the same treatment for the same disease from different branches of medicine. So we have to keep in mind this also, what for the concomitant drugs, and especially because over-the-counter medication is very common in India. So we have to keep that in also in mind and ask the patient about the over-the-counter medications. And next will be the details of the serious adverse event. So what was the at what site, body site, or what was the severity of the serious adverse reaction, what were the signs and symptoms which were present, and what was the start date of the onset of serious adverse event, what was the stop date, whether any de-challenge, obviously de-challenge may have been done, but whether or not re-challenge have been done, and what was the setting of whether the patient was taking medication in the hospitals or in the outpatients or in the home or in nursing home, and what was the outcome, whether the patient recovered or whether it was a fatal, or the patient had a prolongation of hospitalization, had any disability or incapacity. So these have to be reported in the serious adverse event report. Now, for our academic purposes, the clinical trials which we, as an academician, we take take part in our institutes, we don't have to report to the DCGI. So what we have to do, within 40 days of the serious adverse event occurrence, the principal investigator has to report it to the ethics committee, and with the initial report. And within 14 days of the occurrence of the severe adverse event, the principal investigator has to give an analyzed report to the ethics committee. And uh, and these clinical trials which are being done in the academic clinical trials, these are not, these cannot be utilized by the industry for approval of the pharmaceutical products. So this is important that we don't, as an academician, I don't report to the DCGI, or rather I report to the ethics committee uh, of my college, of my university, or my academic institute. And within 24 hours, I have to give an initial report, and within 14 days, I have to give an analyzed report. And another important point here is that we have a signed consent from the, we have to have a signed consent from the, informed signed consent from the all the participating patients, that no compensation other than the treatment for the serious adverse event would be given by the institute or the principal investigator, or the uh, and and in very rare circumstances, the compensation committee can approve for some compensation uh, to the participating subjects or patient in a clinical trial, but this should not coerce the patient to participate in the clinical trial. That is very important, that the compensation should not be that much that the patient is coerced, that once we are going to give him informed signed consent, that, and we are telling him that compensation would be given, and that compensation would be that amount only, which will cover up the treatment part and any day-to-day expenditure of the patient, and will not coerce the patient to participate in the clinical trial. So, and this completes my brief review of the reporting of serious adverse event. And these are the reference materials which you can utilize for your further enhancing your knowledge on the reporting of serious adverse event. Thank you all and have a great day. If you have any questions, you can.
Thank you, sir.
Okay. So I thought you would have left. Okay. So are there any questions on the game?
Yes, sir. We have one question from the delegates. If there is SAE due to drug under clinical trial and causal relation is there as probable, then how we decide whether to continue the clinical trial or not in patient interest? Over to you, sir.
So so a single report cannot be used to assess whether clinical trial should be stopped or not. A single report, if the causality is certain, then only it can be used to stop a clinical trial. If it's a single report is probable, then it cannot be used to stop a clinical trial. So I think, however, certain, if the causality is certain, then that report can be used by the regulatory authorities to stop the clinical trial. But a single probable won't be used, cannot be used. However, many probable similar severe adverse events can lead the regulatory authorities to stop the clinical.
Thank you, sir. We have another one question, sir. That what are expected and unexpected areas, sir?
So expected areas in case of clinical trials are the expected areas which are there mentioned in the investigational brochure. And in case of drugs which have already been approved, expected severe areas are areas which have been there in the packagings, which are mentioned in the packagings. And unexpected areas in case of clinical trials are those areas which obviously which are not mentioned in the investigational brochure. And in case of clinical trials, those areas which are not mentioned in case of drugs which have been approved, areas which are not there mentioned in the packaging.
Thank you, sir. And one final question, sir. Is there any ethics committee in DCGI to see SAE to monitor industry-sponsored trials?
Yeah, there is a ethics committee in the DCGI to monitor.
Okay, thank you, sir. Thank you for your time and your thoughtful presentation, sir.
Thank you. Have a great day and best of luck
Thank you.
for everybody.
Thank you, sir.